Hi, my name is Ana Cristina Wong and I want to talk about tumor regression and allograft rejection after administration of anti-PD-1. First, I'd like to talk about the introductions. Although antibodies against the programmed DEath1 PD-1 receptor and one of its ligands, PD-1, have produced tumor regressions in multiple cancer types, these therapies are untested in patients treated with long-term immunosuppressive medications. Here we report a case in which PD-1 antibody was administered to a solid organ transplant recipient with metastatic cutaneous carcinoma. The patient had a robust antitumor response along with allograft rejection. The patient had a robust antitumor response along with allograft rejection. In this case suggests that anti-PD-1 can be highly effective against cancers arising in the context of chronic immunosuppression. It also suggests that PD-1 pathway may be critical in maintaining the partial tolerance that prevents T cells medicated allograft rejection. Here we have a video about the tumor regressions and the allograft rejection. Then we have the definitions. What's transplant rejection? Transplant rejections occurs when transplanted tissue is rejected. It is rejected by the recipient's immune system, which destroys the transplanted tissue. Transplant rejections can be lessened by determining the molecular similitude between donor and recipient by use of immunosuppressant drugs after transplant. Here we have another video about the transplant rejection. And now we're talking about anti-PD-1. A key factor in the development of melanoma is the ability of cancer cells to evade the body's natural defenses against foreign and diseased cells. These therapies aim not to kill cancer cells directly, but to block the pathway that shields tumor cells from immunosystem components able and poised to fight cancer. We have a video about the anti-PD-1 and how it's work. Now the case. A 57-year-old woman underwent kidney transplantation from a deceased donor in 1989. She received standard long-term immunosuppression including cyclosporine and prednisone. She presented with metastatic cutaneous squamous cell carcinoma in March 2014. Kidney function remained stable after reduction of immunosuppression to 5 mg of prednisone daily. Her cutaneous carcinoma progressed, first during cetuximab therapy and then during trametinib therapy. Her tumor contained a loss of function mutation in NF1. She began anti-PD-1, explained renal allograft showing evidence of rejection and expression of PD-1 pathway molecules after administration of PD-1 antibody. 2 months after initiation of anti-PD-1, the patient had acute allograft rejection despite administration of high-dose glucocorticoids, and the patient transplanted kidney did not recover. Histologic and immunohistochemical evaluation of the explanted kidney revealed severe acute and chronic cell-mediated rejection. Here we have another video about how it works and the cancer, the method. And in the conclusion, this case shows that the critical role of anti-PD-1 pathway both in immunoresistance by cancer arising in the context of long-term immunosuppression and in the maintenance of partial adaptive tolerance to transplanted organs. The latter finding contrasts with those of our earlier report in which 2 organ transplant recipients with melanoma who were treated with antichronic T lymphocyte antigen 4 did not have rejection of the transplanted kidneys 5. 5 suggesting that the pathway may be lesser role than the PD-1 in transplant tolerance. We speculate that PD-1 pathway agonists could be useful in the prevention of allograft rejection. And here we have the opinion of a doctor that says that says the same as I just said. Thank you.